Hello, I'm Barry Eisenberg, Associate Editor of the Journal of Graduate Medical Education and Professor of Medicine at the University of Miami Miller School of Medicine. It gives me great pleasure to be here today with Dr. Jeffrey Siegelman, who is the lead author for the journal's August 2018 Spotlight on Authors paper that is titled Gender Bias in Simulation-Based Assessment of Emergency Medicine Residents. Dr. Jeffrey Siegelman is Assistant Professor of Emergency Medicine and Associate Program Director in the Department of Emergency Medicine at Emory University School of Medicine. Dr. Siegelman, we're so happy you can join us today. I'm very excited to discuss your paper with you. Can you start out by giving us a few examples of what got you interested in this very timely and important topic?
Thanks so much for having me. You know, we know that gender bias exists across the spectrum of our career. In fact, bias of all kinds, but particularly gender bias has been well documented. And I was sitting at a plenary session a couple years ago at our national meeting, and the speaker was talking about a gender bias and a large data set of end-of-shift evaluations in emergency medicine. My co-author, Josh Wallenstein, leaned over to me and said, "Do you think our simulation assessments control for this?" You know, at that point, we had been doing about 3 years of semi-annual, milestone-based assessments in simulated environment for all of our residents. And we thought it'd be worth taking a look, and I'm glad we did.
Thank you for sharing that background with us, Dr. Siegelman. As an Associate Program Director, what do you feel the implications are for your work for other program directors?
Since the rollout of the ACGME Milestone Project, program directors have been re-examining the tools they use for resident assessment. We all want tools that are accurate, reliable, and certainly free from bias. That's why we're really proud that this work has shown that the simulation assessments that we do did show no bias either on the resident side, the faculty, or in the interaction between the two. So when a program director selects which tools to use, and in the back of their mind they're wondering whether their shift evaluations or rotation evaluations do reflect some gender bias, they may choose to implement an objective simulation assessment such as this one.
Another question is, since the focus of your research is on the evaluation of important skills of residents, what do you feel are the implications of your work with the trainees themselves?
Sure. So the goal of competency-based assessment is that we are assessing our trainees on their own merits and strengths and weaknesses, not in comparison to their peers and not with bias.
Thank you again for joining us.
Thanks so much for having me.